So I'm going to auscultate your heart sound, which is the second intercostal space on the right. And I'm going to do the left second intercostal space. And then third and fourth and fifth. This would be the aortic, the pulmonic, the tricuspid, and finally the mitral. I'll use both my bell and my diaphragm. Okay. And this is where I find the apical pulse, where I count for 1 minute, noting rhythm, which yours is regular, even, and again, I would count that for 1 minute and make sure it's within normal bounds. Okay, and so the next thing I want to do, I also check for color when I walk into the room. I make sure her skin's not extremely moist, she's not diaphoretic. I'm also looking at symmetry of her thoracic cage, her posturing, if her muscles are aligned. I'm also going to palpate the carotid artery, and then I'll also auscultate it for a brewery. I'll feel it for a thrill. Listen to it for a purr. So first I would find it, and I'd find it on either side. I'm just going to use the right side. Feel it right there. Okay. And then I'll listen. Hopefully, not hearing anything. Okay. So I didn't hear anything, no breweries. I would do the exact same thing to the other side. Okay. Okay. All right, and also, while I'm doing all of this, I'm also looking for symmetrical expansion of the chest. So I can be assessing the heart while also assessing the lungs as well. So first thing I'm going to do is going to check the lungs from right to left. Deep breath. This is important. Again. Okay. I'm going to get a little rest there. Thanks. So much fast now on this. Okay. Okay. And I can also use my stethoscope to listen into the inner clavicular spaces and have her deep breath again. While I'm here, I'm going to check for vibration. I want you to say 99 every time you put my hand on your chest. So go ahead. 99, 99, 99, 99, 99. Okay, I'm going to do it to the back now, before I listen. Okay, go ahead. 99, 99, 99. One last time. 99. One more time. 99. Okay, so great. Also, I've already kind of assessed the front. Now I'm going to look at the back, make sure all the bones are aligned even. Same with the muscles of the neck. The spine is in alignment, midline. And I'm also going to check for, if you turn to the right just a little bit, I'm going to check for symmetrical chest expansion from back here by pushing a little bit of skin in on your 10th intercostal space. Have you take a deep breath. Okay. My hands go out together and come back in together all evenly. So I will also do my assessment for any kinds of mumps, hopefully no mumps, any kind of bumps or tenderness. Would you say that you're experiencing any tenderness in your back or your chest, or when you take a deep breath? Any coughing? No. Okay. Okay, so now I'm going to percuss posterior lung fields. Should hear some resonance. So down here, it sounds more dull, just because the diaphragm and the lungs are actually up here. Hers sound great. Okay, so then I will auscultate her lungs, just as normal. Let's see, looking for breath sounds, clarity, any crackles, coarseness, etc. So I go T1, 3. I'm going to skip the scapula, so I'll go down to 5, 7, and then from there, I can also do some whispers. I have her do some whispers such as 9, 9. I'm only going to have her do a couple just for demonstration. So I want you to whisper 9, 9. 9, 9. Okay, again. And one last time. And I could go through the whole fields, but just for demonstration. And then I'm also going to have her say E at a normal tone, but I just want you to hold it, okay, when you feel my stethoscope. Okay, just at a normal tone. E. Okay, start again. E. One last time. Okay. So, along with that, I'm just assessing whether I can hear her in the lung sounds. And I'm always assessing clarity, and if it's the same on both sides. Overall, you have great lung sounds. They're clear bilaterally throughout.
Starting with scapular elevation, can you shrug your shoulders? Hold and don't let me move you. Scapular elevation, grade 5 out of 5. Can you bring your arm up by your face? Good, and back to center. Good, shoulder flexion. Hold, don't let me move you. Good, grade 5 out of 5. We'll take it out to the side. Good, and hold it back in the center. Hold here. Shoulder abduction. Don't let me move you. Good, grade 5 out of 5. And can you take the arm back up by your ear? Good. This will be scapular abduction and upward rotation. Hold, don't let me move you. Okay, grade 5 out of 5. Very nice. Moving to elbow flexion. So can you move your arm up and down as straight as you can? You straighten up. Okay, good. And back to center here. This will be elbow flexion. Hold, don't let me move you. Elbow flexion, grade 5 out of 5. Can you bring your arm by your side? Flip it down. Good. All right, and back to neutral in the center. This will be forearm pronation. Don't let me move you. Good. Grade 5 out of 5. Can you open it up? Okay. This will be supination. You can hold it back in the center. Don't let me move you. Good. Forearm supination, grade 5 out of 5. Can you lift up your knee like you're marching? Good. Hip flexion. Don't let me move you. Grade 5 out of 5. Can you kick your foot in? Good. This is hip external rotation. Don't let me move you. Good. Grade 5 out of 5. And can you kick your foot straight out? Knee extension. Hold. Don't let me move you. Grade 5 out of 5. Okay. Can you kick your foot that way? Hip internal rotation. Hold. Don't let me move you. Grade 5 out of 5. And you can rest your foot in my lap. Okay. This will be ankle dorsiflexion. Toes to your nose. Hold. Don't let me move you. Grade 5 out of 5. All right, we'll move to foot eversion. Kick your foot out to the side. Good. Hold here. Don't let me move you. Grade 5 out of 5. Can you bring your foot down and in? This is foot inversion. Hold. Don't let me move you. Good. Grade 5 out of 5. All right, we're going to move to toes. So can you curl your toes around my finger? Good. Hold here. Don't let me move you. Toe flexion. Grade 5 out of 5. And curl the big toe. Great toe flexion. Don't let me move you. Grade 5 out of 5. All right, bring your toes up. Hold, don't let me move you. Toe extension, grade 5 out of 5. And the big toe. Hold, don't let me move you. Great toe extension, grade 5 out of 5. Okay, very nice. Can you lay down on your back for me? Okay, so we're going to start with cervical flexion. So can you just bring your chin straight up? Good. Hold here. Don't let me move you down. Good. Grade 4 out of 5. And can you turn towards me? And lift up to my hand. Hold. Don't let me move you. Cervical rotation, grade 5 out of 5. Hands behind your head. I want you to lift up just so that your shoulder blade clears the table. Good. Trunk flexion, grade 5 out of 5. And you can lift up and turn to me. Good. Trunk rotation, grade 5 out of 5. I can feel the internal obliques on the side towards me and external obliques on the side opposite of me. Can you bring your arm across your chest? Good. All right. Don't let me move you here. Good. That is shoulder horizontal adduction, grade 5 out of 5. Okay. Can you turn on your side to face this way? Okay, so we'll bend the bottom leg. Okay. I'm gonna move the table. We're gonna start with hip abduction. All right, can you lift your foot up to me? Hold here, don't let me move you. Good. Hip abduction, grade 5 out of 5. I'm gonna support the top leg, straighten the bottom leg, and lift it up. Hold here, don't let me move you. Hip adduction, grade 5 out of 5. Very nice. And you can turn onto your stomach. Can you slide forward so that your upper body is off the table? All right, and hands will go behind your head here. Thoracic extension, lifting your chest up. Good, and relax. Grade 5 out of 5. You can come back. Head off the table this time. Good, and I just want you to lift your head straight up here. Hold, don't let me move you. Good, cervical extension, grade 5 out of 5, and you can slide down. Your whole body is on the table. Hands behind your head. Hands behind your head. Nope. All right, and you're gonna lift your upper body as high as you can. Lumbar extension, I'm gonna give that a grade 4 out of 5. Okay, good, and you can turn, perfect. All right, can you bring your leg up as far as you can? Good, okay. This is gonna be knee flexion. Hold, don't let me move you. Knee flexion, grade 5 out of 5. You can straighten your leg here. And can you lift the whole leg off the table? Good, hold here, don't let me move you. Hip extension, grade 5 out of 5. All right, and can you lift your palm to me? Good. This will be shoulder extension. Hold here, don't let me move you. Grade 5 out of 5, very nice. And can you bring your thumb up like a V? Good. This will be scapular depression, lift up. Don't let me move you. Scapular depression, grade 4 out of 5. Okay. We'll bring it off to the side, elbow here. I'm gonna rest under here. All right, can you kick your arm out to me, straighten? Good, hold here, don't let me move you. Elbow extension, grade 5 out of 5. All right, you're gonna keep the arm straight. Keep the arm straight, lift it up, hold here, don't let me move you. Good, that is shoulder horizontal adduction. Excuse me, shoulder horizontal abduction, grade 5 out of 5. All right, you're gonna kick your hand up to me, hold here, don't let me move you. Shoulder external rotation, grade 5 out of 5. I'm gonna rest the towel here. You're gonna bring your palm up to me in the back. Shoulder internal rotation, don't let me move you. Good, grade 5 out of 5. Okay, you're gonna bring your elbow up to me. There we go. Hold here, don't let me move you. Scapular adduction, grade 5 out of 5. Can you bring your palm to, or your hand to your back? Good. Okay. And I want you to hold it there. Can you lift your hand off your back? Hold here. Don't let me move you. Rhomboids, grade 4 out of 5. Okay. And you can relax.
Please, and move only with your eyes with my motions. Great. So cranial nerves 3, 4, and 6 are intact to extraocular movement rather. Go ahead and look at an object off in the distance for me, please. We're going to check cranial nerves 2, 3, and 4, and then look back at the top of my pen light. And I can see that cranial nerves 2, 3, and 4 are intact to accommodation based on the fact that Kelly's pupils dilated when she looked back at the top of my pen light. And finally, we're going to check cranial nerves 2 and 3. Excuse me, and I am going to put my hand right between your eyes here and shine my light. And I see that Kelly's pupils are responsive to both direct and consensual light. Also, I'm going to shine my light right now on both eyes, and I'm checking for corneal light reflex, and I can see that that line falls symmetrically on both eyes. Lastly, I want to go ahead and palpate your brow. Any pain here?
Nope.
And the lacrimal gland, any pain?
Nope.
And then the lacrimal puncti and duct.
Okay.
All right, and I don't appreciate any swelling, any redness, and I see that no exudate is expressed with palpation, so the eye exam is within normal limits. We're going to go ahead and do the ear exam next. I'm going to start by checking cranial nerve 8, which is your hearing acuity. Go ahead and plug one side of your ear. I'm going to whisper 3 words, just whisper them back.
Cat, dog, toy.
Great, and we'll do the same over here.
Orange, green, purple.
Great, so cranial nerve 8 is intact, hearing acuity. When I'm inspecting Kelly's ears, I can tell that the placement is proper based on the fact that the top of the ear is above the outer canthus of both eyes. I'm going to look at the left ear, checking for any deformity, swelling, or lesions, and I don't see any. And then I check the right ear. I don't see any deformity, swelling, or lesions there either. I'm going to palpate the auricle of the ear. Let me know if you have any pain.
No.
And then I'm going to, the tragus, any pain?
No.
Great, okay. So ear exam is within normal limits. We're going to move on to the nose. When I'm looking at Kelly's nose, I see that there's no deviation. There are no lesions or rashes to the nose. And that there is no deviation, rather. So I'm going to go ahead and I'm going to use my pen light to inspect the inner structure as well. All right, and I see that in the right and the left ear, the mucous membranes are moist and that the septum appears straight. Go ahead and plug one side of your nose and sniff in. And the other, great. And so that shows me that the nasal pathways are patent. And then we're finally going to check cranial nerve 1, which is the olfactory nerve. Kelly, go ahead and close your eyes. I'm going to have you smell something underneath your nose and just tell me if you can tell me what it is.
Lemon.
Yes, absolutely. So cranial nerve 1 is intact. And so the assessment for the nose is within normal limits. So we're going to go ahead and do the assessment for the mouth. And I'm going to start by looking at the lips with my light. I'm looking for any lesions. I see that the lips are moist and there does not appear to be any swelling. Go ahead and open up for me. And I see that there are mucous membranes and the buccal area is moist. Lift your tongue up for me. I can see that Stenson and Wharton's duct are present without any erythema or edema. I'm going to go ahead and use my tongue depressor. Callie, go ahead and say, Okay, great. So I can see that the tonsils are present. They're not inflamed and there is no exudate. I can see the hard and the soft palate of the mouth are pink and moist. And that cranial nerve 12 is intact, cranial nerve 9 is intact rather, evidenced by the fact that the soft palate and the uvula rise symmetrically when Kelly says ah. And actually I put my tongue depressor down, but I need it back. Let me look one more time. We're going to look at her teeth. They're all present. Dentation looks great. No evidence of decay, and mucus, and gum is intact as well. Now Kelly, I'm going to have you stick out your tongue. Go ahead and press it against, there we go. And the other side as well. All right, and I can tell that cranial nerve 12 is intact to coordination and strength of movement based on her tongue's strength and movement against my tongue depressor. And then finally, Kelly, go ahead and swallow for me. Okay, and no difficulty swallowing, so we can see that cranial nerves 9 and 10 are intact as well. So the mouth and pharynx exam is within normal limits. We're going to go ahead and we're going to move on to the neck. When I'm visualizing Kelly's neck, I can see that the trachea is midline, and I want to go ahead and palpate her lymph nodes. Let me know if you have any tenderness, any pain at all. So preauricular, the postauricular, tonsillar, submandibular, submental. Okay, great. Occipital, post-cervical, superficial cervical. Go ahead and shrug your shoulders. And supraclavicular. And so I put any pain with any of that. So the lymph nodes were all smooth. I didn't palpate any lumps. So those are all within normal limits. I'm going to go ahead and have you shrug your shoulders against my hands. We're checking the spinal accessory nerve. Go ahead and turn your head to the left, to the right, and that's cranial nerve 11, which is intact. And then for range of motion, we're going to check cervical range of motion. Go ahead and look down and look up to the sky, left ear to left shoulder, right ear to right shoulder. Look over your right shoulder, look over your left shoulder. Great, and so I don't palpate any crepitus, and so range of motion is intact to the cervical area. So lymph nodes and neck assessment are within normal limits. So now we're going to go ahead and move on to the thorax and the lung. So I'll come right over here. And so when I'm looking at Kelly's thorax, I can see that it is conically shaped, which is typical and appropriate. Get here so you can see me a little bit better. And when I'm looking at her breathing, there's no evidence of labored breathing, which I would observe if she had any intercostal sternal retractions or any accessory muscle use. I want to visualize the back of the thorax, posterior. I'm looking for any redness, suspicious lesions or scabs, dryness. And I don't visualize any of that, just a few freckles here and there. I'm going to go ahead and palpate on either side of the spine with my thumbs. All right, and the lower back. Go ahead and take a deep breath in and out. Great. And as you can see that my thumbs expand symmetrically, which lets me know that expansion is symmetric. I'm going to palpate down the length of the spine. Kelly, tell me if you have any discomfort.
No.
Okay, so no paraspinal muscular tenderness. Palpating the costovertebral angle. Any pain here?
No.
Any pain here?
No.
I'm going to do a quick hit. Let me know if you have any pain.
No pain.
Okay, so no pain at the CVA angle. I'm going to percuss the lung field starting at the apices, and I should be hearing resonance throughout. Paraspinous, subscapular, lateral. And then Kelly, I'm just going to have you raise your right arm. And so I hear resonance throughout, which is what I should be hearing. That's normal lung sounds for percussion. I'm going to go ahead and place my stethoscope on your back. Take a deep breath in and out of your mouth each time you feel me move my stethoscope onto your back. And I hear resonance throughout, which is normal. And I'm going to go ahead and listen to the anterior chest as well. Oh, I'm sorry, I hear vesicular breath sounds throughout. Okay, and again, I hear vesicular breath sounds, no adventitious breath sounds in the posterior and the anterior chest. So the thorax and the lung exam is within normal limits. I'm going to go ahead and have you lie back, and I'm going to begin the cardiac exam. All right, so I'm visualizing the chest for any lifts, heaves, or bounding, which would let me know that Kelly may potentially have an enlarged heart, and I don't see any of that. I'm going to lift up her bra line so I can visualize the fifth intercostal space, which is the PMI, and I can actually visualize that quite well on Kelly. I'm going to go ahead and palpate the carotid arteries. All right, left is strong and equal to the right, which is also strong. I'm going to palpate the precordium. Also feeling again for any heaves or lifts. And then I'm palpating the PMI, which I can palpate well on Kelly. I want to go ahead and I want to auscultate her carotid arteries, and I'm listening with the bell of my stethoscope for any bruits. All right, and no carotid bruits. I'm also going to listen to the chest, the five cardiac landmarks with the bell. I'm listening for any murmurs. Aortic, pulmonic, Herb's point, tricuspid, and mitral. No murmurs appreciated. Now with the diaphragm, same cardiac landmarks, listening for split beats or extra beats. So aortic, pulmonic, Herb's point, tricuspid, and mitral. And no split beats or extra beats, so the cardiac assessment is within normal limits. Now I'm going to go ahead and assess her peripheral vascular system. So I'm going to start with the brachial arteries, and these pulses are equal, +2 bilaterally. The radial, equal and +2 bilaterally. I can see that her upper extremities are pink, warm, and dry. Skin is intact. Capillary refill is less than 2. Okay. So we're going to go ahead now, and I'm going to assess femoral artery. Equal bilaterally. Go ahead and bend your knees for me, Kelly. All right, palpating popliteal, +2. Skin to the lower extremities and warm and dry. There's no edema. Evidenced by me pressing on her shins. Posterior tibialis, +2. Posterior tibialis to the other leg, +2. Pulses are equal. And dorsal pedis, or dorsal pedalis, +2 and equal bilaterally, okay? So now we're gonna go ahead while you're laying down.